So what are we going to cover today? Well, we're going to look at what we actually mean by loneliness and agree a definition on that. We're then going to look at the scale and the context of the issue. And then I want to share with you the 10 causes and the 4 types of loneliness. We're going to look at the psychological and the health implications of that. And then finishing up with a really important bit about how to prevent it and prevail as both as individuals and as leaders. So we've got quite a lot to get on with, so let's crack on without any further ado. Number 4 is around relationship loss, and of course there are very different ways that we can lose relationships. It can be due to relationship breakdown, it might be due to bereavement, it can be due to social circumstances in terms of social circle changes. It can also be caused by moving away due to work or education, and of course remote working. You know, as a result of us working a lot more from home, we are losing that connection, that physical connection of being with our colleagues and our co-workers and seeing them face to face and interacting with them and all those other different kind of conversations that happen outside of purely work-based ones. So that can have a really big impact as well, that relationship loss. Some other things to really think about, you know, in total, 45% of adults feel occasionally or sometimes lonely in England. That account equates to 25 million people in the UK are reporting feeling lonely occasionally or sometimes. As we talked about, it is part of the human condition, but it's worth making sure that that doesn't go to become too much as well. So characteristics of people who are more likely to experience loneliness include people who are widowed, people with poorer health and long-term illnesses as well. They often report an increase in feeling lonely to often or almost always lonely.